Gum disease is very, very prevalent in our society. I think the most recent studies that I've seen is that 75 to 80% of the people in our population have some degree of gum disease. So it's very, very common. It's also a very, it's a silent disease, meaning that most people don't know they have it because it typically doesn't hurt. Now, it can be uncomfortable, but it's a lot like somebody having high blood pressure or high cholesterol until they go to the doctor and the doctor takes their blood and go, hey, you got high cholesterol, or they put the thing on their arm and pump it up and say, oh my goodness, you have high blood pressure. A lot of times there's no symptoms. So a lot of times people don't know they have it, so it's important that they're evaluated, and it's very, very simple evaluation. It's relatively painless for most people. It just takes some x-rays so we can look at the bone levels, and then we go around and we measure the attachment levels around the teeth. So it's a real simple way to find out. But left untreated, when someone has periodontal disease, especially if they have or gum disease anywhere or most of their mouth, if they've got it throughout, that is an infection about the size of the palm of your hand. So I always tell people, if you walked around with your hand and it was red and it was puffy and when you rubbed it it bled, would you be concerned about that? And you know, inevitably everyone says, oh my gosh, that would be terrible. So what I try to stress to them is when they have gum disease, that's basically what's going on. Is there's enough tissue there that if you took it out of your mouth and put it on the palm of your hand, that's about how much infection they have there, and it's a low-grade infection. The concern with leaving it alone is that it increases your chances of heart attack, stroke, low birth weight babies if you're a woman of childbearing age. Recent studies have suggested that it could be linked to pancreatic cancer, predisposes to diabetes, and lots of other bad stuff. So it's a bad deal because it sets up conditions in our body that precipitate these other things that are happening. Some of the warning signs that somebody might see if they haven't been to the dentist and the dentist has said, hey, you know, you have gum disease, we need to treat it, are that they may see pink in the sink. You know, that's what we tell our patients. You shouldn't see pink in the sink. And if when you're brushing or flossing you're seeing pink, or if you just wake up in the morning and you spit and you see blood, that's not a good sign. It's something that needs to be evaluated. The other thing that I'll see sometimes is somebody will come in and go, you know, doc, my teeth have been shifting, or this gap used to be this big and now it's this big, and so we'll take x-rays and it's because the bone has disappeared secondary to the gum disease. So that's a symptom of it. Another symptom can be chronic bad breath. You know, a lot of people come in and complain about having chronic bad breath, and so that's also another condition that might present.